Good evening, all. We are going to continue with the series of lectures on the basic laparoscopic surgery course. We have had 3 lectures already, and today we will continue with one important aspect that have modernized laparoscopic surgery. Even though this is one of the aspects that is related to 1/4 of complications that are seen in laparoscopic surgery. So, because of this, it is very important to have the basic knowledge on the principles of the use of energy in laparoscopic surgery and the various types of energy sources in laparoscopic surgery procedure. So today, we are going to talk on the commonly used and commonly available energy sources. The energy sources in modern surgery are used in basically cutting and coagulation of tissues. And each of these sources has its specific properties and limitations. Now, this will help you in selecting the choice of energy device you prefer, because various surgeons prefer one type or another of these energy sources. So the one you will prefer and more conversant with, you need to know specific properties about that and the various limitations. Now, energy sources, they account for the second most common complication associated with laparoscopic surgery after varus or trocar placement. You should understand that the commonest cause of complications in laparoscopic surgery is placement of the port during the access. During the access, one can injure a major vessel that would warrant opening to secure hemostasis. At the beginning of the procedure, you might just have to abort that procedure and convert to open, struggling with bleeding. Now, the second most common cause of complication is the use of electrosurgical device. You can see placement of trocar during access accounts for about 41%, while use of energy devices account for about 25%. Now, understanding these energy sources, their limitations and hazards is essential for a successful outcome and reduce energy-related complications. So it's very important. Now, we should all know that electrosurgery uses alternating current in a frequency range of 500,000 to 2 million hertz. Now, with this high frequency, the rapid reversal of this high frequency prevents changes in ionic positions across cellular membrane. Okay, hence no neuromuscular depolarization, muscle contraction, or cardiac defibrillation, unlike our household currents with low frequency. So the high energy frequency that is used in laparoscopic surgery, they have this tendency of rapid reversal. Hence, they do not cause all these effects on neuromuscular tissues. Now, it is important for us to understand the various waveforms in electrosurgery. Now, there are 3 main waveforms used in electrosurgery: the cutting, coagulation, and blending. These are the 3 main waveforms, which we'll see shortly their meaning. Now, the aim of electrosurgery is one, to produce the intended effects with the lowest effective power output without associated risk. If you are to take any information out of this lecture today, the most important thing you should go with from this lecture is you should produce an intended effect with the lowest effective power output from your energy source. Because with the lower output, you have least chance of developing complication. With a very high energy output, there is a high risk of developing complication. So you should always reduce your energy source to a low voltage that will give you the desired effect, because this energy that is dissipated on the tissue have particular effect on that tissue. Now, this depends on the masterful knowledge on electrosurgical instruments and skillful application of the above factors. So it's very important. Now, how do we classify the energy sources or the energy devices used in laparoscopic procedure? Now, the classification usually are into electrical sources, thermal sources, radio frequency sources, and electrothermal sources. Now, you may come across some various classifications, but this is a broad classification, and we will talk about some, not all, of the energy sources here. We are going to talk about the electrical sources because this is one of the sources that is well known to us in the open surgery. Our diatemy we use is also applicable in laparoscopic procedures. Then the thermal sources, which could either be in the form of ultrasonic energy, okay, that is transformed into mechanical energy and having cutting and coagulative or vessel sealing effect on a tissue, or the laser, then the radio frequency, then electrothermal. So we'll concentrate on the electrical and the ultrasonic energy sources. Now, you need to understand an electrosurgical circuit. This is the common one we all know, our diatemy machine. The circuits include a generator, which you can see. This is the generator of the electricity, the current, the generator. You have two electrodes. After the generator, there are two electrodes. Now, there's an active electrode which is placed on the tissue, which could either be this monopolar with different type of tip, or a bipolar. That is the active electrode that is placed on the wound of the patient. And you have the indifference electrode, the pad that is placed on the body of the patient, the body surface, on a flat surface of the body. So those are the electrodes. You have the active placed on the operating site or the wound. Then you have the indifference electrode that is placed on the body of the patient and the patient. So current passes is generated from the generator, and it passes from the active electrode into the indifference electrode through the body of the patient. Okay. So now, electrosurgery follow the basic rules of electricity. We are going to see the basic rules of electricity. Now, this picture is just to demonstrate the surgical circuit. Okay, the surgical circuit. We'll go in detail. This is a circuit that is used for an open surgery. This is what we are all familiar with, the diatemy machine. Okay, even though these points are applicable for the laparoscopic surgery, but the devices that will serve as the electrodes now, the handheld devices, are different, are designed in such a way they can be passed through the port and gain access to the operating site. Now, before we go into all those details, let's see the basic rules of electricity. Now, current. Now, current is a flow of electrons. You know the electrons as they flow. That flowing of electrons is what generates current, and it measures in amperes. Okay? What is the drive of this current? What makes the current to flow is the voltage, which is measured in volts. And this voltage drives a current to pass through a body. That body the current is passing through is the resistance, okay? And it is measured in ohms. So it means the body is serving as an impedance to the flow of current. So you have a current, which is the flow of electron. You have the voltage, which drives the current, as you have the resistance, which is the body that serve as an impedance to that flow of current. So that is the basic rule. Now, Ohm's law states that current is equal to voltage multiplied by the resistance. To increase a current, you must increase the voltage and reduce the resistance. Okay? Now, what is power now? Power is the amount of energy produced or consumed per unit time, and is measured in watts. So power is equal to voltage times current. So with higher voltage and current, you need higher power of electricity to be consumed. If you deliver high voltage and high current, high watts or power of electricity will be consumed by that resistance. Now, when resistance is increased, voltage will also increase, okay, to maintain the power needed to produce the desired effect. And of course, in the body, you know, there are some tissue that have, the tissues of the body have varying resistance, okay? Tissue that have more water content have less resistance than tissue with less water content that have higher resistance, okay? So these are basic principles in physics we need to understand with the use of all these energy sources, and you see how they are all applicable. High voltage is associated with increased electrosurgical complication. If you remember the golden statement we made at the beginning of this lecture, that if you are to go home with a single point from this lecture, is to produce the desired effect with the least amount of energy. You should produce the desired effect you want on the tissue with the least amount of energy in order to minimize the risk of complication. Don't be surprised. You are operating on a target organ because of excessive energy is going to be causing a complication in an organ that is completely out of your operating field. We'll see all those complications shortly. Okay, these are all just basic rules in electricity about a circuit. There's a path along which current flow. A duty cycle is the ratio of one time to the total on and off time in a of a signal measured in ratio or percentage. Frequency is the number of cycles or waves of alternating current occurring per second. That you see waves. So the number of waves you see in 1 second, the number of cycles, but you know the alternating current, as the name implies, it alternates. The number of cycles it goes in 1 second is called the frequency. Now, electrosurgery uses high frequency, okay, to avoid the paradigm effect of nerve and muscle stimulation, okay, which cases at the frequency above 100 kilohertz. If you remember, we said in electrofrequency, in electrosurgery, the frequency is high. Why? So that all the effect on the muscle, okay, will not cause a permanent change, so that it will be rapidly reversible. If you use a low frequency current, the changes on nerves and muscle will not be rapidly reversible. Okay, as the frequency is commonly used in electrosurgeries are greater than 500 kilohertz, which is like the radio frequency. So you hardly have such effects. Okay, now let's see the basic principles that brings about cutting and coagulation, as well as blending or fulguration of a tissue. If you remember, we said there are 3 waveforms used in electrosurgery. 1 is cutting, 2, coagulation, 3, blending or fulguration. Okay? When the intracellular temperature rises rapidly to more than 100 degrees Celsius, cellular vaporization, okay, with explosion occurs, leading to cutting effects. So a high temperature above 100 degrees Celsius will cause explosion of the cells, and this will lead to cutting of the tissue. A gradual increase in temperature between 60 degrees Celsius and 95 degrees Celsius leads to simultaneous tissue desiccation and coagulation. So the temperature below 100 degrees Celsius will rather cause denaturing and coagulation of the proteins, which will produce the effects of coagulation, while 100 degrees and above will produce cutting, because it bursts and explodes and vaporizes the content of the cells. Now, what is fulguration? It's a non-contact sparking, okay, with coagulation output to produce superficial layer of black coagulation over white oozing. So fulguration or blending is used for a wider surface area, not a point for coagulation or cutting. It just spread a wide area of coagulation where there is a widespread oozes. This uses high voltage, okay, with a low duty cycle of 6%. Okay, let us see the temperatures, various temperatures and their thermal effects on tissue. Of course, 37 is normal body temperature. When the temperature rises to 40 degrees Celsius, no structural damage. When it is up to 50 degrees Celsius, there is cell death within 6 minutes. When it is 60 to 95 degrees Celsius, when it is 60 degrees, there's instant cell death. When it is 60 to 95 degrees Celsius, instant cell death, desiccation, and coagulation. okay, white coagulation. 100 degrees Celsius will cause cellular vaporization and will give the effect of cutting of a tissue. Okay, up to 200 degrees Celsius, of course, which some of the instruments you will see shortly can go above, will cause carbonization, that is black coagulation of the tissues. Okay, now electrosurgery, as we said, is derived through either monopolar or bipolar instruments. They are derived through monopolar or bipolar instruments. Now, the monopolar instrument, the active electrode is in the wound. If you remember your diatomy pencil, the one you use in cutting or coagulating, the one you are placing in the tissue you are cutting is the active electrode. Okay, the patient's return electrode is attached somewhere else, okay, on the patient. That diatomy part is the return electrode. Currents must flow through the patient to return, okay, to the return electrode to complete a circuit. I'll show you a diagram shortly that demonstrates the arc of that flow of current. Now, in a monopolar setting, you have an active electrode, the patient is the resistance, and you have an indifference electrode or a return electrode attached to the patient. When you place that on the patient, the current flows through the patient and it is received at the diatomy part, or the indifference electrode or the return electrode returns that to the generator to complete the circuit. Now, in bipolar, you see the beauty of the bipolar. Both active electrode and the return electrode are, okay, performed at the site of the surgery. The bipolar is just like a forceps. So the current just flow in between the tissue you are grasping. It doesn't flow through the patient. You don't need a pad for a bipolar energy source. Okay, the two jaws of the faucet performs the active and return electrode functions. Okay, only the tissue grasp is included in the electrical circuit. Okay. Surgeons can avoid complications of electrosurgery by understanding the mechanism underlying, okay, them. Now you can see this circuit in the bipolar electrode. You see, if these are the faucets, they just pass in between the faucets. They don't just between the tissue that is grasped, but for the monopolar, it has to be transmitted through the patient. This demonstrates the same thing. The active electrode is held by the surgeon. You can see the patient is the resistance and the return electrode is here, and the current passes through this. Now, you should always remember, to avoid burns. Patients' place should be placed correctly, okay, on a vascular muscle mass. Avoid bony structure. So when you are placing that plate, you should avoid all the pad. You should avoid bony structures, irregular contours, so that you have a very good contact. That is very important. You have a very good contact, okay? And it must be well vascularized, and you should avoid bony structures. Body part should not be touching a metal. Sometimes you see the patient is positioned and his hand, that armrest always take note of that armrest. Sometimes you see the padding fall off and the patient's hand is on the armrest and there are some nuts or metals on that armrest. So you have to be very, very careful. The patient can sustain burns. You should make sure any patient you are using an energy device is not lying on any metallic object. Patient should not be wearing ornaments, okay? Now the bipolar. The bipolar are generally safer than monopolar instrument because the current flows between the two electrodes and through the graft tissue. It uses continuous low voltage waveforms. Bipolar instruments achieve their hemostatic vessel sealing effect through one, the electrosurgical effect of desiccation and coagulation of tissue grafts between the electrodes. So when it grafts the tissue, it causes desiccation and coagulation. Remember, we said between 60 and 95. Mechanical compression obstructs the blood vessels, okay? That eliminates heat sink and helps develop proximal thrombus. So that forceps that is grasping the vessel, okay, will compress these two and it will create a temporal, it will create a thrombus here, as well as coagulating this portion, leading to hemostasis. The two jaws of bipolar instruments are like newly married couples that love being together and has no need to look elsewhere. The reason why we say newly married couple, when the instrument is still new, okay, it gives you your desired effect. With time, you will see how it will become like a single-spirited bachelor that is not satisfied. After a certain time, the honeymoon period of the bipolar couple is over. Okay, the proximity leads to heat. Their proximity leads to heated quarrels that disturb other family members and neighbors. And with time, as your instrument wear out, just like couples that have been there for many, many years, okay, that honeymoon period is over. The next thing, you see neighbors coming to settle quarrel and a lot of disturbances they will be causing. So that is how the bipolar is. With time, as you keep on using it, as you keep on applying it, what happens? If you apply it for a very long time, what happens? Look at what will happen. For instance, if 100 watts is applied for 3 seconds with bipolar, the temperature between the jaws is 300 degrees Celsius. You can imagine we say 200 degrees cause charring, black coagulation. Now, 3 millimeters lateral to that tissue will be like 200 degrees. So you see, just lateral to the tissue where you are applying that instrument is 200 degrees Celsius. 5 millimeters lateral is 100 degrees. 6 millimeters lateral is 55 degrees. And you remember our table on effects of temperature on body tissues. So you can imagine a cell dies at 55. So collateral damage is at 6 millimeters. So you as a surgeon that is using this, you should know that just lateral to the tissue, this is what will happen. Okay, so you need all this information when using all these devices. To avoid such situation, okay, lateral spread or bipolar couple settles down to discuss what? The matter. rationally, and finally agree on the following. Okay? Use less energy. You have to talk over issue quietly instead of raising your voice. You have to use less energy. Don't forget, when you are using a bipolar instrument, use less energy. Intermittently, okay? Squabble or are less frequent, so you can use it intermittently. Don't just hold and press for a long time. You can see the effect it produces in just 3 seconds. Now, overall small area. Use overall small area. All your discussion only in the bedroom so that that family and neighbors are not disturbed. Don't pack a lot of tissue and cause serious collateral damage everywhere. So you have to be very careful when using this instrument. Now, look at what the bipolar looks like. You can see this is the bipolar forceps for open surgery. The cords are the same, okay? Now, this is what a bipolar for laparoscopic surgery looks like. You can see the cords, and this cord is fitted here. There is a plug where it is fitted at this point. Now, the tips now can take the blade of a Maryland or a grasper. There are different types of blades that may come with it, but you should know how a bipolar forceps look like. This is how a bipolar forceps look like for a laparoscopic procedure. Now, the monopolar. This is free-spirited bachelor who takes the path of least resistance, enjoying himself with whatsoever, whoever is willing, be it on either side, collateral damage, anywhere else on its way to the patient's plate. Anything along its way, it can destroy. You can see monopolar is relatively more dangerous than bipolar, okay? It can just, because the distance it is crossing now can cause serious damages, especially along part of least resistance. It does not take kindly to rejection and destroy whosoever resists its advances, which are usually the narrowest places, okay, like the ureter. So you can see when you are operating around, okay, the pelvis, you can easily cause ureteric injury, okay, which is maybe might even be remote from what you are operating. It's also in the habit of charging others with its energy. You can see this free-spirited bachelor. It doesn't even limit itself. Its damage cannot be contained. You can see it can even be charging other things that are not even compatible, okay, like plastic, okay, leading to irrevocable destruction in their marital life by what is called direct coupling, which we'll see in the complication and capacitative coupling. So monopolar has tendency to cause more destruction than even the bipolar, which we will see in the complications. Now, let us see the difference. This is the monopolar we use in the open surgery. And this monopolar L-hook instrument, you can see the tip is called L-hook because it has a hook that looks like an L, and this is attached to this point. It fits into that socket, and you activate using your foot pedal, sometimes this can be fitted into the diatemic pencil, you know. You don't need foot pedal in that situation. You just use the normal buttons for the cutting and coagulation. Now, even with all these complications we mentioned, why do we still use monopolar instruments? Okay, because all instruments cannot be made bipolar. Any instrument can become monopolar. You see, most of these instruments, they have a point where diatemy can be connected to them, whether being grasper, Maryland, scissors. Once you connect, it becomes a monopolar instrument. Okay, you can transmit energy through that instrument. So monopolar is very important in laparoscopic surgery. Any instrument can become a monopolar. Now, bipolar can only coagulate. Bipolar do not cut. When they trap tissues in between, they only coagulate. You see, this L hook is used for coagulation and it is used for cutting of tissue. Monopolar can coagulate and cut. Bipolar cannot fulgurate. Why monopolar can fulgurate? You see, this monopolar instrument you are seeing is very versatile. It can be used for several procedures. So what you need to do is to understand how it can cause complication so that you can use it well. When you use it properly, you may find out that you have maybe little need for highly expensive gadgets during your procedures. Now, we talked about cutting and coagulation. What is blending? Now, this blending is a combination of both cutting and coagulation at various degrees. If you see some diatemy machines, it will be written blend 1, blend 2, and blend 3. They all have meaning. When you see blend 1, it has 50-50, okay, but more of cutting. So blend 1, if you press the knob on blend 1, it has 50-50 of cutting and coagulation, but it cuts more. So you have blend 2 is 40-60, it cuts less. Okay. Then blend 3 is 25-75, it has more coagulation. This is very important because you see some diatemy machine with all these labels. You should understand the meaning of all these things. Now, we use pure cutting, okay, in tubal, intestinal anastomosis to leave healthy tissue behind the structure. Now, when you want to cut intestine or the tubes by the gynecologist, don't use coagulation, because as you are coagulating, you are leaving behind dead tissues at the edges of that tube you are cutting. So when you anastomose, you have high tendency of maybe failure or breakdown. Okay, you use pure coagulation for bleeders. Blend, when cutting and coagulation is required at the same time. So you see, you need to understand when to use blending, e.g. incorpotomy or myomectomy. So what you'll be setting on your machine now is blend. Fulguration or spray, you use this for a greater surface that have wide oozes. Coagulation from a distance has a greater spread but less depth. So you are more of securing hemostasis on a widespread oozes, like in endometriosis. Now, this image is very important for you to understand. If you remember the physics, the basic rules of electricity, we mentioned about frequency and voltage. We said that the electrosurgery has high frequency. You can see for pure cutting now, look at the frequency interval between these waves. They are very short, so the frequency is high. But look at the voltage. If you look at the height of the voltage is low. So for pure cutting, you will have a high frequency and a low voltage. This will give you 100% pure cutting. Now for blend 1, you see 50-50. Blend 2, this is what we described. But for coagulation, when you are coagulating, now you have a high voltage but low frequency. Now it is very important you know all these things, especially those who will have interest in going for some formal exams in laparoscopic surgery like diploma and so on. You'll be answering MCQ questions. So all these things will be very important when they are asking you questions on energy sources. You'll be seeing questions that are related to these things. Factors that modify electrosurgical tissue effects, like electrical waveforms. We've talked about that, whether cutting, coagulating, or blending. Then you have power outputs. We mentioned higher outputs have more desiccation of tissue and tendency for more complication. Electrode surface, activation time, coaptic coagulation, tissue impedance, and ESCA. All these are factors that will modify. I think we've talked about pure cut, yellow pedal, blue pedal. We do all this. Now, this image here is very important. Now, there are some, it is very important you know how the bipolar cause hemostasis. One, it coapts the tissue. Okay, you can see the collagen are fusing together. And 2, there is a proximal thrombus that is formed. Now, sometimes, especially those that are like the gynecologist, for example, when they want to coagulate the uterine arteries. Now, if you don't use the bipolar energy properly, this is what will happen. You have a clot here, and this has not completely sealed. Maybe you are not using the energy properly. You have a clot here and it seals temporarily. Okay, but this is not completely sealed. When that clot dislodges, you have bleeding. Okay, you have already cut something proximal and there is no proper seal. There will be torrential bleeding. The higher voltage obtained in coagulation mode lead to a visible voltaic arc, which creates a superficial coagulation, okay? Carbonizing the surface, increasing the tissue impedance, and not allowing the diffusion of the thermal effect in depth. Now, you remember, let me just give you an example. If you are frying a chicken and you use a very high temperature, if you just put the chicken inside, the outer part will just look fried immediately, but the inner part will still be raw. It will not, the depth will not, the heat will not penetrate the depth or the core of what you are frying. So, but if you are using a low and steady heat, the heat will go in depth and cook the core of what you are frying. So that is the principle you use in securing hemostasis. Now look at this we just mentioned. It can lead to a catastrophic result. So you use a low energy and hold for some time. And for the uterine arteries, bigger arteries like that, you have to see some bubbling around the artery before you release. But you will see a more modern equipment that have a feedback that will make an alarm to tell you that there is complete sealing of a vessel. Okay. Now, we've mentioned one of our important opening statement that you should never forget. Okay, use the minimum energy output to get your desired effect. Now, power output is displayed in watts. Use the lowest effective power setting to achieve the desired effect. The most important take-home message for this lecture. So don't think that all the time you need to set your diathermy at a very high level to achieve an effect. No, remember it has a side effect on your tissue. Higher wattage is associated with increased risk of unintended tissue burns. A power setting between 50 to 80 watts is recommended for effective cut mode. Between 30 to 50 is recommended for effective coagulation mode. When I'm operating in the bowel, I normally use energy less than 25, usually. Maximum, I don't go above 30 watt of my setting. So you see the risk of complications is least. And of course, you get your desired effect. Okay. Electrode surface area. The smaller the electrode, the higher the current concentration. Okay, all these, you are going to see all this in the slides when we share. Now, you should know that long activation time increase extent of tissue damage. Too short a time may result in inadequate tissue effects. Now, all these things may be very difficult to determine with all these conventional instruments. But of course, with the advanced ones, you will see some measures that are put in place to bypass all these problems. Now, let's see one important electrical bypass effect of a bipolar instrument, the conventional bipolar. Despite their technical advantages, conventional bipolar devices may not always produce adequate hemostasis and may require repeated applications with an increased risk of lateral thermal spread. Okay, surgeons must rely on subjective visual clues such as changes in the tissue, color, or vapor bubbles to judge the adequacy of the tissue effect. Now, electrical bypass effect, look at this diagram now. There's a tissue in between the forceps, and you can see the tip of the tissue, the tip of the forceps are touching, okay? Over compression of the tissue between the jaw of the bipolar instrument may cause the tip of the jaw to touch, leading to, electrical bypass, okay, and deficient tissue coagulation. Now, it is expected that when you are coagulating a tissue with bipolar forceps, it should remain like this. The tip shouldn't touch each other so that the current will flow from one forceps to another, causing the desired effect of tissue coaptation. But if you have a bipolar forceps that is touching like this, the current will flow from one limb to another. You are leaving a space here. And after you think you have coagulated adequately and you cut something, you just see bleeding. So we just talked about the conventional monopolar and bipolar instrument we all know, the diatemy machine. The difference in use with laparoscopic surgery is just the handpiece, which we've seen. For the monopolar, you use the L hook or you attach the cable to any of the instruments, it becomes a monopolar instrument. But for bipolar, you have a specific handheld bipolar faucet that you attach the faucet. Now, there are some advanced bipolar which are produced to bypass some of the negative hazard we saw from the conventional instrument ligature. The ligature and the end seal, there's another instrument called the end seal. The difference is just the company that are producing them. This is produced by the Covidian, while this is produced by the Johnson & Johnson, but they are both bipolar instruments. The ligature, it delivers a combination of pressure and energy to create a consistent seal with each application. It is designed to deliver high current and very low voltage to tissue. High current, low voltage. It monitors tissue impedance between the two jaws of the instrument and continuously adjusts the delivery of energy. Now, once you apply, it is designed in such a way that it does not deliver excessive energy that will cause tissue damage. Why? There is a feedback control response system that automatically discontinues energy delivery when the seal cycle is complete, okay, eliminating the guesswork that you are using from your visual estimation. In the conventional bipolar, you see the bubbling, the change in color and all that. No. For this, there's an alarm. When it has sealed the tissue, it will make an alarm, okay? Signifying that you can go ahead to cut the tissue without bleeding. It provides a natural permanent seal containing the patient's own collagen. There's minimal sticking, tissue charring, and thermal spread. You remember the lateral thermal spread of a conventional bipolar. This doesn't have, it has just minimal. So this instrument is designed in such a way that it has both a cutting and coagulating tip. Now, when you grasp a tissue and seal, when the tissue, the vessel is completely sealed, it will now make an alarm. If it makes an alarm, okay, when you press this is the handle here, this handle. When you grasp and press, what it does, it will seal the tissue. As it makes that alarm, it means the vessel is sealed. You now press this knob. As you press that knob, it will now cut the tissue. So that is how the instrument is used. Okay, so this will prevent unnecessary injury to the tissue. So this is the generator, the ligature generator. This is the Covidian FT10 generator. You can see the advantage of this FT10 is you can see it has your conventional monopolar, bipolar, and the ligature. So if you have this FT10 machine, you don't need any diatemy machine. You have both conventional monopolar, conventional bipolar, and advanced bipolar on a machine. So for most of the advanced laparoscopic surgeries, they can only be done when you have all these equipment. Okay, so if you don't have all these equipment, you just get stuck with doing basic laparoscopic procedures. Now, one of the disadvantages of all these instruments, they are very expensive. They are not readily available in most of the centers. Okay. Now, these handles you see, they are disposable, not that you continue using them, okay? That is another reason why, of course, they are very expensive. This is a disposable bipolar instrument. This is the ligature handle we are talking about. This is where you activate, and this is where you press to cut after it has made an alarm. This is a disposable bipolar instrument with both coagulation and cutting facility, and is attached with a wire to the energy source. It can have a diameter of either 5 or 10 millimeters. It seals a vessel up to 7 millimeters. Now, this is very important, you know. You may be asked, what is the size of the vessel that is sealed by a conventional monopolar energy source? Okay, it's just 1 to 2 millimeter vessels. What is the size of the vessel that is sealed by a conventional bipolar instrument? That is just up to 5 millimeters. Okay, so now you can see the advanced can seal vessel up to 7 millimeters. You know, the diatomy seals below 6 millimeters, that is 5. The bipolar will seal up to 5. Now you can see the advance is sealing vessels up to 7 millimeters. Okay. Now, it seals vessel up to 7 millimeters in 1 second and for 4 seconds when used with advanced energy platform to provide permanent vessel fusion without dissection or isolation. It delivers combination of pressure and energy to create a consistent seal with each application. This device is very, very beautiful. It's very interesting. When you use it, you will see how it works. And of course, all these devices you see, they make your surgery very fast and safe. Okay, very fast and safe. If you remember, when you are dissecting with your monopolar or bipolar, you see a lot of charring, a lot of smokes. Okay, all these ones have less, especially the harmonic, the ultrasonic you see. Now you can see how this exerts its effect. You can see the pressure by the two jaws, as well as the sealing of the tissue by the body's own collagen. Now, let's talk about the harmonic scalpel. This is an ultrasonic device. Now, harmonic scalpel is just, as we call that advanced, we call the ligature or the end seal an advanced bipolar. You can call the harmonic monopolar with brain, but this is not it does not use electricity. It uses ultrasonic energy into mechanical energy, and that is what gives you your desired effect. Use ultrasonic technology that allows both cutting and coagulation at the precise point of impact, resulting in minimal lateral thermal tissue damage. You see, all those problems of lateral tissue damage are eliminated with all these advanced devices. And very interesting about all these devices, they are just simple to use. They have automatic settings. You just plug and apply. Once you plug the handle, okay, it will just auto set. Okay, there are some settings you will see, maximum 5, minimum. Okay, we'll come to that later when dealing with that practically, but they are very easy to use. The ultrasonic technology, as we mentioned, it provides minimal lateral thermal tissue damage. This ultrasonic generator convert ultrasonic energy into mechanical energy. Now, coagulation occurs by means of protein denaturation to form a coagulum that seals small coapted vessels. Cut and coagulate by using low temperatures than those used by electrosurgery or laser. You can see this even give you a desired effect at a lower temperature. Now look at how the jaw of the harmonic scalpel looks like. It has two jaws, one active jaw that is vibrating. Is the ultrasonic that is now converted to mechanical, vibrating at a very high frequency that will now cause cutting. Okay, that ultrasonic is converted to mechanical. It's rubbing at a very high frequency to cause the desired effect. So this is the active jaw. This other white one is called the Teflon jaw, or the jaw that just holds. So this is the one that vibrates while this holds the tissue in place, and the vibration will cause the effect. It has an active blade that vibrates, okay, and a white passive blade that holds the tissue. So the harmonic scalpel, it is the active blades that exert the effect. This other white is called the Teflon jaw, okay? The Teflon jaw, it doesn't exert the effect of vibration. What it does is just to hold the tissue in place. Now, fewer instrument changes are needed. Less tissue charring and desiccation. Now, when you are using harmonic scalpel, the beauty in harmonic scalpel, there is no smoking. Okay, there is no smoking. You know, when you are using the electrosurgical instrument, either monopolar or bipolar, you have a lot of smoke in the cavity. Okay, you have to open one of the ports to let out some of the gas so that the smoke flows along. Then you close. But for harmonic scalpel, they do not generate this smoke. So the visibility in surgical field is improved. It has the least thermal spread and smoke production of all the devices. And when you use harmonic scalpel, there is no scar. You don't see that burning or charring you see in monopolar. So you call the harmonic scalpel a monopolar without its danger. So don't forget, it's not a monopolar device. It's an ultrasonic device that converts ultrasonic energy to mechanical energy to produce a desired effect without charring, without smoking, with a least spread of energy to the lateral tissue, causing least lateral or collateral damage. Now, one of the disadvantages of this harmonic scalpel is the after use heat effect. The tip will still carry some temperature, so if it can touch another surface and cause little burns. Now, the harmonic scalpel, it has 3 compatible probes. Okay, they share the blade and the hook. Okay, these are what you couple, the disposable part. You have the generator. Now, this handle you see, you use it for some certain numbers of surgery. You have to get another one. You can see why the use of all these advanced instruments are very expensive. Okay, you have to be replacing this handle. It is disposable. Maybe if used for some certain number of cases, you have to change the handle. Okay. Now, if you look at the machine, there are 5 settings. It has 5 power level from 1 to 5. And this is what they all represent. Okay. So this first one is for coagulation, and this is for cutting. So cutting and coagulation, the least you go, the lower you go, it gives you more coagulation and less cutting. Okay. So when you put on the machine, by default, you see it at 3 and 5. Okay. So at 3 is giving you in between a balanced cutting and coagulation. But if you put both at 5, it will give you less vessel sealing effect and more cutting effect. So most of the time when you plug on the machine, you see a default setting. And if you want a more better sealing effect, you should take it between 2 and 3, especially if you are coagulating a larger caliber vessels. And it's a very good dissector instrument that you can use for very good dissection. Now, what is the power setting we just talked about? Increasing the power setting levels increases cutting speed and decreases coagulation. Less power decreases cutting speed and increases coagulation. Faster cutting with less coagulation is achieved by increasing the tissue tension. Now, the grip pressure. How do you grip the forceps? Application of a gentle force or light pressure achieve more coagulation with a slower cutting. So when you grasp the tissue gently, you apply more of coagulation than cutting. A firmer grip force achieves less coagulation and faster cutting. So all this you need to know about the handle when you are manipulating a harmonic scalpel. What are the side effects? Greater residual heat. At the tip, they will have greater residual heat after the desired effects. So do not keep on adjoining organ after use, because the harmonic scalpel has greater residual heat than even the ligation. Do not use in a pool of blood, as it cannot coagulate and spread at the same time. So it can perforate blood vessels, okay, if active accidentally on them due to a knocking effect. Now, there's an improvement of even the harmonic scalpel, the harmonic ACE, alternating currents emulation. It's one of the first device with purely ultrasonic energy device with a 7mm vessel sealing indication. Remember, we said the monopolar seals 1 to 2 millimeters. The bipolar can seal up to 2 to 5 millimeters. Now the advanced instruments, now the advanced bipolar, number 1, the ligation is an advanced bipolar. It seals up to 7 millimeters. N-seal is also an advanced. Harmonic scalpel, 7 millimeters. Okay, so these are very important, you know. It delivers unmatched precision, multifunctionality, and now advanced hemostasis for stronger, larger vessel sealing, less tissue damage, stronger, more reliable sealing. Harmonic also has better results in terms of less postoperative pain and complaints by patients. Now, we've seen our conventional energy sources as well as the advanced energy sources. Now, what is a newer device that have both a combination of the harmonic and the advanced bipolar? You can see how everything is just advancing. Now, the newer device is called the Thunder Beat. It is the only advanced energy system to deliver two well-established forms of energy to a tissue simultaneously. The ultrasonic energy for superior dissection and fast cutting. The advanced bipolar energy for secure hemostasis and sealing vessel of up to 7 millimeters in diameter. So you can see this has combined an advanced bipolar and the ultrasonic energy, leading to what? Fastest cutting speed, thereby reducing operation time, reliable 7 mm vessel sealing, precise dissection with fine jaw design, bipolar energy for hemostasis without cutting, minimal thermal spread, fewer instrument exchange, you see, reduced mists generation, help to maintain visibility. Now look at how the Thunder Beat handle looks like. You can see one of the jaw, okay, is, you see, you have ultrasonic and bipolar probe. Then you have a bipolar jaw. This is how the machine looks like. Olympus is the company, one of the companies that have this device. And this is the effect of Thunder Beats on the tissue. You can see it has ultrasonic energy, rapid and precise dissection, hybrid energy. You can see it has both the coagulating, sealing effects, as well as the dissection effects, and the bipolar energy for a reliable vessel sealing. Now, let's quickly look at the complications of energy sources. Electrosurgical complications are responsible for 1/4, 25.6% of complications associated with laparoscopy. You remember, we said the commonest cause of complication in laparoscopic surgery is port entry. Second is energy devices, okay? So, what are these complications? In monopolar, if you tabulate the complications, monopolar lateral thermal spread is more, is less in bipolar. Direct coupling is more, less in bipolar. Insulation failure is more, can be seen in both. Capacitive coupling, alternative site injury, inadvertent activation, okay? Current leak through cord, residual heat. These are all complications that are seen with the use of all these energy devices. But we will just talk on just, I think, 2 or 3 of these complications. Then we will now end the lecture. Now, direct application. Injury from lateral thermal spread to unintended tissue near the tip of the activated electrosurgical instrument is the commonest type of electrosurgical injury. Potential thermal burns to the bowel, ureter, or blood vessels. The extent of lateral thermal spread depends on the device used, the power setting, the tissue impedance, as well as activation time. Monopolar device can result in high temperature and the greatest degree of lateral thermal spread compared to bipolar and ultrasonic ones. Factors affecting lateral spread. Okay, now these are the variables, these are the lateral thermal spread. For current, okay, you see continuous, it is increased. The lateral spread when you are just giving a continuous current, but when you pulse, it decreases. If the voltage is high, it's increased, low power setting, and down the line, tissue compression, longer application time, monopolar coagulation, all these increase lateral. While all this, when you pulse, lower voltage, lower power setting, okay? When you have high, that is small pedicle, shorter application time, and bipolar, they all reduce. Now, direct application. To reduce lateral thermal spread, a shorter activation time is recommended at a minimum power output. Avoid proximity of electrosurgical device to vital tissues such as bowel, ureters, or blood vessel. Secure hemostasis near such structures with the use of sutures, clip, rather than electrosurgical devices. You can have inadvertent activation. So anytime you are using the monopolar or any of the energy instrument, make sure they are not active. Okay, make sure you are not stepping on the pedal or activating the electrode when it is inside the body. Only activate when you are at the desired point of action so that you don't cause inadvertent injury. Now, the residual heat on the tip can touch other structures and cause unintentional damage. Now, sometimes the insulation, you see most of these energy devices, they are insulated. You can have insulation failure, especially at the proximal third. Okay, proximal third, the tip of that instrument, you could have some form of insulation failure. And as we are trying to work at the target organ, just adjacent to the organ, you find some undesired burns occurring, okay, because of insulation failure, which is commoner at the tip. Now, direct coupling occur when the tip of your active electrode is directly touching on another metallic instrument, okay? When it touches on another metallic instrument, and that can cause an unintentional injury to a structure that instrument is lying. For example, if the active electrode accidentally touches the laparoscope, that laparoscope becomes electrified. Okay, it becomes electrified and it can cause injury. However, if there is a metallic trocar, it can spread along the body, anterior abdominal wall, to reduce that effect. There's also a capacitive or capacitative coupling. This term is used for the phenomena where electrical current is established in a metallic instrument running parallel to the active electrode. There's no direct contact, but of course, by capacitative effect, is transferring current to the instrument that is active, that is running parallel to that electrified energy device. There is a transfer of current from one conductor, the active electrode, through intact insulation into adjacent tissue without any actual contact with the tissue, finally leading to trauma. Okay, so that other instrument will now cause trauma. The use of metallic trocars can reduce the risks by allowing stored energy from the capacitor to dissipate over the large surface area on the patient's skin. Okay, all this diagram is just describing what we just explained. Okay, you can see how this is even causing injury to the colon here when your target is at this area, because you can see this, you are putting effect here and it has transferred the effect to another instrument, causing damage to somewhere you are not working on. So in conclusion, newer energy devices are an appealing, safe alternative for cutting and coagulation, tissue dissection during surgery, decrease operation time, and increase versatility during surgical procedure. The principle of usage should be applied to avoid the hazard associated with the use. So this is the end of the lecture for today. Of course, we know lectures that have to do with physics or energy devices generally, they are not too interesting. But of course, no matter how uninteresting they are, you must be interested, because you might just go, you don't have an excuse of not saying because energy devices are not too interesting, you are not interested. So you will be causing a lot of havoc. So thank you very much. If you have any question, you can go ahead and ask. I can see most of the participants have left, maybe because of network or have an issue, they don't like physics. So if you have any question, please, you can unmute yourself and ask. Otherwise, we will just call it a day. The next lecture will be on sterilization of laparoscopic instrument. By the way, as a surgeon, you should know everything about your laparoscopy, both what the technicians should do and know, what the peri-op should also do about sterilization, everything about laparoscopy. You as a surgeon, you should know all other roles and how they perform, other members of the team, how they perform their own task, because sometimes they may not be available and you have to do some things. If you just limit yourself to just the operation, you don't know how to set up your instrument, you don't know how to sterilize your instruments, you'll be in trouble. So the next lecture will be talking about sterilization of laparoscopic instruments. So any question, please? If you have any questions, you can ask. If there are no questions, we'll call it a day. Okay, thank you very much. It appears there are no questions. So we are going to end the lecture now.